Something we pride ourselves on at PHC is we are fluid and flexible. And that is how we are going to handle the next 3 days, because we want you to get the most out of this conference.
You're in for 3 days of stories. Quite a few of you are going to be telling the story of the research that you've done, the findings that you've got, and also there's stories to go with the posters. So make sure you go to those poster sessions where the speakers will be standing there and willing to talk to you. And it just gives you so many ideas as to how you can develop your own stories for your own research.
This is where the Primary Healthcare Research Conference gives you a convenient and very concentrated opportunity to discuss all things primary healthcare.
Australian Primary Healthcare Research Institute here in Canberra have shown the way in terms of that sort of linkage activity and that real effort and putting resource into thinking, how do we commission research differently, how do we link researchers with policymakers in some different sort of ways, and indeed engage with practice in some new ways.
We have together a magnificent mix. We have in this room the researchers, the policymakers, the administrators, the educators, the practitioners and the consumers. All of you all bring your own perspectives, your knowledge and your skills. But more importantly, we are all on the same side. We are all driven to improve our primary healthcare and are here to not only talk, but also to listen and to learn from others' perspectives.
As medicine grapples with the advancing complexity of knowledge and treatment, Beric argues we need to do 2 things. Firstly, we need to measure ourselves, and secondly, we need to be more open about what we're doing, because openness drives improvement. And so improving policies and practices requires that we have to be open to new ideas, be willing to try new things to make health outcomes better.
It's not just about research, it's not just about practitioners, it's about the whole system, and we need to look at it as a holistic approach. Health reform is a term we often associate with the system. But what's the system? The system is us. It's made up of people, and we need to have the creativity to change. It's people like you, individuals who can make a difference individually and moreover collectively if we exchange ideas, if we collaborate.
I think follow your passion. Research what you think's really important, that you're willing to stay up late at night to do and spend all your weekends and all that sort of stuff. The best innovation will come from those of you in this room who are really passionate about something and are prepared to follow it all the way through to the end, no matter whether it's a sexy, policy relevant question or not. If it is, that's best, but go for your passion.
David.
I think look at the complexity of what's happening in relation to reform and see it as an opportunity so that in 2020 you can look back and see what a legacy you've left for the Australian community.
We can close that gap between research and policy so that we can really fulfil what the conference theme is about, to influence, inform and implement primary healthcare at its best.
It is important to note that the knowledge exchange continues long after the conference ends. Keynote presentations are webcast, and concurrent sessions with synchronised audio and PowerPoint are also uploaded on the PHC website. Go to www.phcrs.org.au for more information.